Margaret, how are you? My name's Lauren and I'm going to be your nurse today.
Hello, Lauren.
Now, how are you feeling?
A bit tired.
Fair enough. It's not easy to get a good night's sleep when you're in hospital, is it?
No.
I'm just going to very quickly check our safety equipment, okay, if you don't mind? Okay, so I'm just going to do a full patient assessment for you. I've just got some silly questions. Could you just tell me your name again?
Margaret.
And your last name?
Talbot.
Margaret Talbot. Excellent. And when's your date of birth, Margaret?
The 4th of the 1st, 51.
4th of the 1st, 51. Oh, you just had a birthday. Happy birthday.
Thank you.
And what month is it?
January.
January. And the year?
18.
Yeah, and what day of the week are we?
Thursday.
Beautiful. Excellent. Do you have any pain at all?
No pain.
No pain?
No.
Oh, that's excellent. I'm just going to shine a really bright light in your eyes. Just have a look at your pupil. If you just look straight ahead for me.
Okay.
There we go. Thank you. And then I'll just get you to squeeze my hands. There we go. Pull me towards you. And push away. Beautiful. And now I'm just going to do the same thing with your feet. Can you push against me? Excellent. Pull your feet back towards you. Yep. And lift your legs up. Perfect. Got some good strength there. Okay, now you said you've got no pain. That's good. Are you short of breath at all? How does your breathing feel?
It's not too bad. Just feel a little bit down. Just not 100%.
Yeah, that's okay. Well, we've started the antibiotics now and hopefully you'll start to feel a bit better with your breathing. We'll see how we go. Now, I'm just going to listen to your breathing as well. Okay, Margaret, can you sit up for me, please? Thank you. Oh, just listening at the back now. Thanks very much. Okay, there. Your breath rate is about 22 breaths per minute, so it's a little bit faster than normal, so I wouldn't be surprised that you're feeling a little bit short of breath there. You're on a little bit of oxygen. We'll see what you... Are you coughing anything up at the moment? Are you coughing at all, or...?
A little bit, just a bit of yellow.
Yes, yeah, okay. We'll keep an eye on that, and I'll check if they've had a sample of that, and if not, we might get a sample today.
Okay.
Yeah. Okay, excellent. There we go. We'll put this one back here. Now I'm just going to take your blood pressure. Now just relax your arm there. This will go a bit tight. Now I'm just going to check your pulse as well. You're feeling a bit warm there, Margaret. Have you been getting hot and cold sweats or anything?
Yes, I have been, yes.
How long's that been going on for?
Since I first got that chest infection.
Yeah, fair enough. I'm just going to check your temperature. Yeah, you've got a very slight temperature, so that's probably not a surprise with the infection there. And your blood pressure is 105. Now you've got hypertension, haven't you? Looks like that blood pressure is actually quite low for you. Do you feel dizzy at all or anything if you sit up?
When I go to the toilet, I feel lightheaded.
Oh yeah. So if you sit up or stand up from bed, you feel quite lightheaded?
Yes.
Okay, that's interesting. What I might do at the end is we'll get you to lie down and then sit on the edge of the bed and do 2 different blood pressures to see if that drops while we're doing this. Now I'm just going to look at your feet here again. So I'm Lauren and I've just done a patient assessment here on our patient Margaret, who's come in with an infective exacerbation of COAD yesterday. Now that we've done the assessment, what are we going to do now? We need to put that information together and think about what the problem is with our patient and what our plan for the day is going to be. So I think after doing this assessment that Margaret's biggest problem right now is that she may be starting to get a bit septic. Her heart rate was 90 beats per minute, while not outside of the normal parameters. It is at the upper end, and over the last 24 hours it has been trending upwards. Also, her blood pressure at 105/40 is at the lower end of normal and once again has been trending in the wrong direction for the last 24 hours. She does have a history of hypertension, so she normally has a much higher blood pressure than that. This is really evidenced by the fact that she's quite symptomatic with that. When she stands up or when she sits up in bed, she does feel quite dizzy, showing that that blood pressure is probably not quite high enough for her. So what I'm doing, does also have a slight temperature at 37.5. So that's another thing that really does make me think that she might be starting to look a little bit septic. My plan for Margaret is that firstly I'm going to have a talk to her and make sure she knows not to try and get out of bed, not to ambulate to the toilet or anything like that without assistance, because she is feeling quite dizzy, and especially if that does get worse, I really don't want her falling over and hurting herself. Another thing I'm going to do is discuss it with the medical registrar when they come round to do their round shortly. We're going to start a fluid balance chart so we can keep a really close eye on the fluid going in and out of Margaret and just see what's happening with that. And the medical staff may want to order some fluid for her. Over the shift, I really want to observe closely her heart rate, her blood pressure and her temperature, and just see in what direction these symptoms go to see whether or not this sepsis does develop or worsen, or whether it does actually get better on its own.